So, Greg, thank you very much for joining us. Where are we going today?
Well, you're driving through one of the busiest roads in Bihar, the northern part of India. These, by the way, are some of the most interesting roads in the world. By interesting, I mean they can be quite dangerous, these roads.
Right, and so we're heading to a village where you're leading with Dr. Das a project in Visceral Leishmaniasis. What's that? Maybe just describe somebody that you've seen with that disease.
Visceral Leishmaniasis in many ways is similar to malaria. It's transmitted by an insect. It's a parasite that gets in the body. It gets in the liver, spleen, liver, and high fever, and eventually it's 100% fatal if it's not treated. Unlike malaria, where a lot of people recover from it, Kala-Azar, you die from the disease if you're not treated. So traditionally, people who've gotten the disease in the village have not been properly treated. They stay in the villages and they continue to transmit the disease. So that's been the situation of Kala-Azar for many years. That has really started to change now, that there are much better treatments, much better diagnostics. But what hasn't changed is the knowledge in the village isn't there. People still don't know what to do when they get the disease. And that's where our project is working with Grand Challenge, is to put some knowledge into the village so that people know what to do. And the way we're doing it is through training of village ashas, which are women that live in the village and look after maternal health. We also put posters in the villages.
Good morning, sir.
And through this training program, ashas are now identifying people with Kala-Azar and making sure they go for treatment. So this is moving people. It's moving into the village and moving people with the disease from the village to the treatment centers.
And in addition to the ASHA, is there anything else that you've been able to accomplish in the project around the diagnosis?
Well, we've been able to show that the diagnostic test can be done under a tree, whereas previously it had to be done in a hospital. So we've been able to make it a point of care diagnosis. And we're also looking at how the disease is being transmitted in the village. We still don't have a full understanding of the reservoir, which people are transmitting it. So we're starting to get a better understanding of transmission in the village as well.
So just to really boil this down for people, can you give an example of a single person you met that, you know, with the disease and what their future would have been like with and without treatment?
Yeah, recently we met a little girl. She was 12 years old. She had Kala-Azar. She wasn't being treated properly. She was going to local healers, and her prognosis was she would have died from the disease quite rapidly. A village ASHA identified her, knew that she had Kala-Azar, sent her for treatment at the primary healthcare center, and now she's perfectly healthy and she's in school and she's got a big smile. I mean, you'll probably meet her today. So that's one typical case, but there are, you know, hundreds of cases like that.
So let's talk about that. You've been working in 4 districts with the project, and what's happened in those 4 communities of about blocks, 200,000 people each? What's happened in those blocks with 800,000 people in terms of the disease, and how is that moving us towards elimination of Kala-Azar or visceral leishmaniasis?
So there's been a major reduction in the number of cases in those 4 PHCs. I'd say there's probably gone down. The number of cases has gone, let's say, from gone down by, we're probably about a fourth as many cases as were there before. So let's say from an area of about 800 cases, we would be down to about 200 cases. In the particular village where we're going to today, there was 27 cases 2 years ago in that village. This year, up till now, there's been only 3 cases. So the number of cases is dramatically coming down in that village. And that's typical of the villages that we would go in with this program, is to bring the number of cases down from up into the 20s down to 2 or 3 cases. And hopefully next year there won't be any cases in that village.
And how many people have been identified through the project and treated?
Well, of the 1,000 ASHAs that we've trained so far, that covers a population of about a million people. So about 1 million people are being covered by the program right now.
And just in terms of the overall plan to eliminate, and if you think about those blocks, how many more of those blocks are there to go that need the cases reduced?
Yeah, so the way to go is to identify those blocks that have the most cases and focus on them. So there's about 20 to 25 blocks which have the highest number of cases, and that would be, let's say, 5 to 10 per 10,000 in those blocks. So those are where the focus should now be, is in those blocks. And I think that would have a major impact again on the overall numbers of cases in Bihar. So it's not a huge number, and it's not spread out over huge distances. So it's something that is really feasible to put the effort into those 20 to 25 blocks.
And what needs to happen in those 20 to 25 blocks?
We need to repeat what we've done in the 4 that we've already worked in. We know basically what to do now. So we know we have the training material, we know how to work with the ashes. So we need to have a strong training program with the ashes. And then we need to, every case that they identify, we need to go into those villages and also test the family members, because we know that these are the people who are at greatest risk of disease. So the next step is to follow the family members and make sure that we identify any cases that have been recently transmitted in those households.
And Greg, last question, how would you summarize the contribution of Canada here over the last few years through this Grand Challenges Canada project?
I think the contribution has been tremendous. First of all, in lives saved, in the number of lives that people would have died from Kala-Azar. And second of all, by putting knowledge about the disease in the villages. I think that's key. Many times you have projects, but nothing actually changes in the village. But this is actually putting a change in the village, because there's now a knowledge there that wasn't there before, a knowledge about what to do when the disease strikes a village like that. So that's a tremendous contribution that Canada has made in this part of the world.
Sometimes the counterfactual here is also helpful. Without the things that you've learned, the testing on blood, the ASHAs, etc., what would that have done to elimination efforts for visceral leishmaniasis or Kala-Azar in Bihar had the project not happened?
I think there would still be the program would still be moving forward, but it would be moving forward much slower. You still wouldn't have enough presence in the villages. That's where the battle has to be now, in the villages, not in the health facilities, in the villages. And so there still wouldn't be enough presence in the village. You'd still have the progress being made, but it would be much slower.
Great. Thank you very much, Greg.